Good day and welcome back to another episode of The Silence Speaks Volumes. Today we have a very special guest that kind of brings a unique perspective to most of us who've been diagnosed with a terminal illness. We have Trusia Burgers, who is a GP who had to become a patient. Welcome to the show.
Thank you, Faisal.
So your journey, would you mind sharing with us how that all started? From the history leading up to you finding out, okay, I've got cancer.
I was diagnosed September 2017 with breast cancer, and it was found just on a routine mammogram. I didn't feel anything abnormal. I've also been going every year for my screening mammograms because my mum had breast cancer, so I've been from a young age going regularly. So I suppose it's always been at the back of my mind that something might happen. So it wasn't such a big shock, but it still is a very big shock if that year you do go and there is something. Yeah, and as you say, suddenly then from the one day to the next, I changed from being the doctor to being the patient, and I think that was quite difficult for me.
So how did you navigate that? Because I think, as being diagnosed myself, when I was diagnosed myself, it was a case of how much information do I want? Now you're sitting with a situation that there's a lot of information that you have, and now you got someone else. How did you navigate that process?
I think I unconsciously made the decision to actually trust someone else. And that was a very good decision for me if I look back, because I very quickly went to see one of my surgeons that I do trust and know very well, and he confirmed everything quickly. And then I went off and saw a breast specialist in Cape Town, and he had a whole team around him that was just seeing breast cancer patients, and I felt very safe with them. I felt I was safe in their hands, I could trust them, and then I actually made the decision to just go with what they say. I also went off to see one of my friends who's a GP, and said to her, today I'm your patient and you must tell me, am I going to the right place? Do I need to start maybe on an antidepressant? What else do I need to do? Because I felt that I couldn't really treat myself and help myself. And that was really a very good thing, because I didn't confuse myself. I didn't doctor hop from the one to the other.
Sure.
And I just gave myself over to them, and didn't Google, didn't look for alternative treatments and things. And I think that was, in my case, a good decision.
So there's two things that are coming up here for me, and the one is, in your case, it seems like early detection was key, and going for your regular checkups. And number two was trusting the process. As a doctor, and this is something that we found came up a few times in previous episodes, where patients aren't always asking the question, what does this mean? What does that mean? What are my alternatives? As a doctor, if I come to you with those sort of questions, you've given me a diagnosis, do you take offense or do you encourage it?
Oh no, I for sure encourage it, because I think it's good for the patient to feel safe and satisfied that that is what they want to do. I also feel that every patient's journey is different in your own setting and with your own history and makeup and family and faith and all of that. And you need to get a lot of information and make a decision for yourself what you want to go through. There's different kinds, in the case of breast surgery, there's different kinds of surgery. You can have just the lump removed, you can have the breast removed, you can have both breasts removed, you can have reconstruction. There's so many decisions, and you need to have a lot of information about that. And I think it's good for the patient to see the specialist, get the options, go and think about it, and maybe then come back and decide make a decision with the team. And what I also have told patients afterwards, since I've been back at work, if they get diagnosed with any type of cancer, is the process starts so quickly and everyone just runs with you.
Yeah.
But actually, the cancer has been there for a long time. It didn't start yesterday.
Yeah.
And you can wait a week or 2 or 3. I mean, you can sometimes even go on a holiday still for a week or 2 if that is what you want to do.
Yeah.
But that you feel that you've made the right decision at the end. So you don't need to rush off to the next best place that you get referred to and get the surgery done that same week. And I think that's good, just to step back and take a
yeah.
breather and discuss it with your family and make sure that all your questions have been answered before you make this. You know, it's quite
Yeah.
a big decision.
You're taking me back on my journey now, and it was a rush. And there was an event I was planning, and in the middle of this planning, we were about 2 weeks off. I got the confirmation you got cancer, and I actually asked my doctor if I wait till after the event to do it, is it going to make much of a difference? And he said to me, no. When it comes to chemo, and this is also something else that came up, is, and I don't think a lot of patients are aware of this, that they got very ill. And the one lady that was on, she said she spoke to her oncologist and said, isn't there, can we not adjust this? And they did, and immediately all that subsided. And that was 14 years ago, and she was given 8 months. So you are also advocating then, for based on what you're saying, speak to your doctor.
Oh
Ask.
yeah, for sure. Yeah, and also get some extra help, because the oncologist is very good to give you the correct chemotherapy and adjust the dose and tell you about the side effects and all of that. But that is just one piece of the puzzle. There is lots of other people that can help you going through chemo. For instance, when I went through my chemo, I went off to see a friend of mine who's a phytotherapist. So it's a doctor of plants. I actually wanted to speak to her about cannabis to see if that would help me with my side effects. And she gave me some other supplements to try. And I must say that's made a massive difference to my side effects. So I went through chemo with the normal side effects. My hair came out and I was nauseous, which luckily was controlled, and I was really, really tired, but I didn't really get a lot of other illness, other side effects. So I really believe that the supplements that I got from her made my chemo much easier. But that's not something that the oncologist is specifically going to tell you about. Yeah. They are just talking about their field. So I think that's the bit that comes in, just to sit back and see who else can help.
Yeah.
And if I look back at my journey, that's actually what I did. Is I involved a lot of people. I went out and looked for various people, and maybe because I'm a GP, I know of who I can go and see. Yeah. But I went to see everyone and anyone to give me advice on making my journey easier. Not on, the chemo was solid for me. I didn't want to get any alternatives. But I think that wellness part, that looking after myself and making it a bit easier for me, that's actually made quite a big difference in my journey.
Just if we can just come back a little bit to when you seek the alternatives, and you came up with these supplements. Is that something you discussed with the oncologist to say? So it is important then to let your physician or your oncologist know that, listen, there's this, is there going to be some sort of...
Yes. No, I think because it's such a critical illness, it's very important that you take it by them. So all of these things I always discuss with my oncologist to make sure that she was happy with that. And I think that's important, to have a doctor of sorts that just trust you and tell you, or that you can trust, and that you just take it by.
Okay, awesome. I think you're shedding a lot of light here, which is, and I'm so loving the different perspective now, because with the medical background, you went through pretty much the same thing I did, and some of the previous guests. I mean, there's a lot of repeats coming up here, which is great. And then there's also, I'm seeing for those viewers out there and patients that it is okay to ask. It is okay to say, hold on, I need to think about this. And you can take an holistic approach that pretty much the doctors are operating almost in a bubble where here's my speciality and that's what I'm looking at. So you have the right as a patient to say, but hold on, I need help with my mental state.
Yes, yes, yes.
And bridge them all together.
No, for sure.
What sort of options are there from your perspective now as a GP? I've come to you for, in my case, it was hemorrhoids. You said, no, you need to see a surgeon because that's obviously not your speciality. The surgeon determines, right, there is the potential that this is cancer. Does my journey necessarily stop by the fact that, okay, my GP has now forwarded me on to a surgeon and I'm just there now? Can I come back to my GP and say, listen, what is happening?
Yes, I think that's very important, and that's actually what I'm trying to bring into my practice now, is helping people through the journey as a GP, that if you've gone through the specialist, you must actually come back to your GP and discuss it with the GP, and sometimes it's good to get a second opinion or a different opinion. Or then the GP can also navigate you to the next step, because as you said earlier, the specialists are all in their silos, so they're not going to glue this all together for you. You actually do need someone that can case manage the whole journey for you. So I think a lot of people don't do that because the GP refers to this surgeon, the surgeon refers to the plastic surgeon or the anaesthetist and the oncologist, but no, it doesn't really come back again to a place where someone asks, so are you happy with this? Are you happy to have both breasts removed? Are you happy with the reconstruction? How do you feel? How's your children coping with this? Are you at work? You know, all these extra practical and emotional things, I think is very, very important, and it's falling through at the moment. That's what my feeling was, and that is actually something that I'm trying to start up in my practice.
That's so amazing. Please bear with us for a moment. We have some bills to pay. We'll be back in a few. Welcome back to The Silence Speaks Volumes, and in studio we have Dr. Trusia Burgers. Trusia, before the break we started looking at how you piecing together all the alternatives that were there for you so that you could take that step back and make a decision on how you're going to proceed. We also started touching on getting help. You want to tell us how you went about getting, apart from now going to what's my alternatives on that, your support structure. How did you get that set?
Yeah, I think one of the important things that a friend of mine told me about is that you should get help for yourself and for your family, and you should let people support you because that's what they want to do, and you should actually tell them exactly what you need from them, because people that's not been through cancer don't really know what you need. And I've actually embraced that, and I created a very big support system on WhatsApp, where I kept people just, I told them about it, and it was lots of friends here and overseas and family members, and then I just kept them up to date if I've been for tests and what's happening when I had the surgery and so. And I must say, just that support, so for instance, if I started my chemo that day, then I would send them a message, broadcast a message and say, I'm going for my first chemo and so and so. And just all the messages flooding back to you was just so supportive for me to know that people are thinking about me that specific day, and it was such a difficult day for me, but it made my life much easier. And then also if people asked me if they could help me, then I always said yes, which is difficult because you don't want to be like that, and you're not so used to get help. But I just made that decision, and it was very good. And if they asked if they could bring food, then I would just say yes, please. Because that was, you know, I needed so much help, especially when I went through my chemo. I would come back from chemotherapy and be fine for the rest of that afternoon. But from that evening, for about 3-4 days, I would be just out.
Yeah.
I would just be lying in bed. It would be hard work for me to go to the bathroom. So I needed a lot of people to help me taking care of someone to take care of me, and also taking care of my family and my kids. They were still very small at that stage.
How old, if I may ask?
They were 2 and 4.
Wow.
So now they are 6 and 4. So that just made my life easier, and it just brought me closer to those people as well who helped me. And you could see that it was good for them as well to give me help. You know, they got something out of that as well. So I think that's very important, to get a support system. I mean, even this morning, because they still follow my journey in a way, or even this morning I told them that I'm coming for the interview, and you know, there would be messages coming through. So I think that's important. Share it with them. People actually want to share your journey with you, and they want to help you, and that makes life easier for you as well.
That is so true. A theme that has come up quite often on the show thus far is the help that people are offering. And very often it is their advice on what you need to do. And very often it was from people who haven't gone through cancer or been diagnosed with cancer. But what I'm hearing what you did was you told them, this is what I need. This is what I need you to do. And they respected that.
Yeah.
So you set boundaries.
Boundaries, yeah. And I also, you know, I would hear what everyone says, but I'll still decide for myself what I'm going to listen to. And I had a very close group of friends that's been through cancer themselves, various types of cancer, maybe 4 or 5 girlfriends. And they were my chemo warriors. So if something needs to, you know, if something is going to happen, or if I know that my hair is going to fall out, then I will just ask them, how shall I approach this? What shall I do? Shall I cut my hair? Shall I shave my hair? Shall I, you know? And so I proactively asked people that I thought knew, you know, or they've been through it, or they would know the answer, and not just like threw myself open and get confused by it.
Awesome. So now, 2 years, you are cancer-free, your cancer is in remission. What is life like now for you?
Life is very good now for me. I think I've gone through a whole transformation with the chemotherapy specifically, because that really makes you feel very vulnerable and weak. And I would say, looking back, it was a positive thing, because beforehand my priorities was maybe not right, even if I think that it was plus minus right. Things really changed for me now. So now I do life a bit differently. I feel that I see everything and everyone a bit differently. Even my patients, when I see them, I feel I connect a bit more to them. I really see them as a person, and I don't see the condition, or that I need to just take care of that and help them through it. So it's much nicer for me. Even if I drive, I would watch people in the other car driving past and notice them. So I think that's just maybe the way, because you know, you've something critical like this has happened to you, and a veil has been lifted.
You have to face your mortality.
Yeah, and you face that, and you just see things differently and hear things differently, and the sky is often much nicer than I can remember. And you know, I see the clouds in different formations, and you know, those type of things.
No, I can totally relate.
Yeah.
No two sunsets are the same.
Yeah, so I feel much more mindful in whatever I do, and how I behave at work, and how I, you know, go around with my friends and my family. So life is much better for me. And I actually feel less anxious. I know a lot of people feel more anxious when they've had cancer. For me, it's been quite a journey of being set free from anxiety, and I got very close to the Lord. So I don't even even if there's not a option like that for the moment, but I don't really have that fear of dying as well. That's not in my, that doesn't make me anxious. So I think it just makes life, you know, much more easier, and I enjoy life as
Less
it is.
stressful.
And yeah.
That's amazing. If you had to sum up just the biggest challenge for you during that period, and how you managed that, and the greatest blessing that came out of this for you in terms of because what I'm liking, and it's the first time we really covered it as well, is your perspective on life afterwards. How would you sum up your greatest challenge and getting over that?
Yeah, I think my greatest challenge was my identity that suddenly changed. Because I was a doctor and I was a mum, and I was, I just could just go, and now suddenly I didn't know who I was. So it was quite a journey to go through that and to come back to the point that I am who I am. I'm not a mum, I'm not a doctor, I'm not my husband's wife in the first place. I'm my own person, and I need to look after myself first, and then I can look after the rest. But that was a very big challenge for me. Now it's much easier. And the blessing, I would say, is the community of people around me that's come so close. I mean, they've really shared my journey with me, and I feel so privileged to have people so close to me in my life. And also that I've had this amazing journey with the Lord, and I've made time for Him as well, because often life is so hectic, and you're just running from the one thing to the next. And when you are ill and you're lying there for hours in your bed, and you have lots of time for introspection and, you know, just to get closer to your to your religion, and in my case to the Lord. And for me, that's been marvelous.
Amazing. That's amazing. So we are running out of time, but if you have do you have a message for the viewers out there? Anybody who's been diagnosed with be it cancer, potentially terminal illness, or disability, what would be the message that you'd like to share with them?
I think firstly to be good to yourself, and involve other people to help you. Take a breather and just step back from the diagnosis and think what you want to do in your situation, and then let people around you help you to get through with that.
Awesome. Thank you so much for your time. I really loved having you on the show.
Thank you very much.
To the viewers out there, and it's becoming very apparent with all the stories that we've shared thus far, that as much as no two cancers are the same and no two people are the same, our journeys when we're faced with a challenging situation is very much similar. There's no cultural, religious, black, white. We all feel a fear. We all have to face our mortality. We all have to face the fact that life is going to be different. And what is important is from the support that you have, that you tell them what it is you need. It's not about what they feel you need. You know better than anybody else what it is that you need. You are also, and we have it from a doctor, you are also allowed to ask your doctor questions. You are allowed to go for another opinion. You are allowed to find out about alternative methods of dealing with this, but it's important to keep your doctor informed. It's important to have that one physician that can case manage your situation. It is not always the end of the world, and in some instances, yes, unfortunately, it is terminal, but you can still live life with the time that you have left. We thank you so much for watching, and we look forward to seeing you next week.